treatment team in the UK. So today we're going to talk about home treatment team in the UK and their duties. So they do crisis assessment. So what they do is when a patient is in hospital or a patient presented in like a general hospital or a patient is at home, they go there and assess the patient to see if the patient needs hospital admission or not. So what they do is they will go to the patient's houses, they will go and supervise the patient in terms of medication. Yes, in terms of medication and all that. So they will go there, they will supervise medication, they will find out from the patient how the patient has been doing, if the patient has been eating okay, if he's been sleeping well, and there hasn't been any incident, in terms of socializing as well, in terms of going out, duties and all that. So they find out. Some patient can administer their medication. So what the team does, they will just supervise the patient to ensure the patient is taking their medications. So during that time, they find out all that. So that's what they do. They also go to the wards to do what they call early discharge. Because some patients, they don't need continuous admission. They go there, they sit with the MDT, the multidisciplinary team, and find out how the patient has been doing. They speak to the nurses, they speak to all the teams, and they can take up the case and discharge the patient home. So when the patient gets home as well, they go there and supervise the patient's medication, they supervise the patient, they check how the patient has been doing, his or her own general well-being. If he's been eating and sleeping, socializing, if it's somebody that goes to work, they find out as well. And if a patient presents in the general hospital and the liaison team can call them and say, please, can you go and assess this patient to see if the patient needs hospital admission? So they serve as gatekeepers. They serve as they support a multidisciplinary team as well. They do early discharge and they do risk assessment as well. They work with the multidisciplinary team. So when they go there, they will sit down with the patient, speak to the patient, assess the patient in terms of risks to see if it's what they can manage or if the patient needs to be transferred to hospital for admission. If the patient does not need admission, they will take up the case and start visiting the patient at home. So this treatment can last for, it can be 1 day, it can be up to 14 days as well. It all depends on how the patient is presenting. It all depends on whenever they go there and they see the patient, how the patient is making progress. So what they do is to make sure everything is okay. So welcome to Growth with Joyce. With the future, confidence in action. Yes, so home treatment team, we call them HTT. So those are their duties. That's what they do. They are gatekeepers, ensure that those who don't need admissions don't need to go to the ward for admissions. Those who need treatments at home, they do all that as well. So crisis assessment, they work with the multidisciplinary team. They go and do home visits, and also they do medication administration. They just do visiting as well. They can just visit and find out how the patient is doing, because some patients don't need medication. They just need that emotional support, that psychological support. So they go there. They also make referrals for psychological input. So other psychologists can come and support the patient while they're at home, because some patients, they don't have much risk and they are agreeing for treatment. They are agreeing to collaborate. They are agreeing to work with the team, so they don't need to be admitted in hospital. Not all patients are admitted. Some patients can be seen by the home treatment team. They don't even need the team to go there. If they have other social networks like families and friends, that can provide support for them. The home treatment team can also do telephone service. They can call and find out the welfare of the patient, how the patient is doing. And the family members, they will report to the HTT and say, oh, he's taking his medication. We have been supervising him. He's doing well. So those are the things that they do. Please, have you subscribed yet? subscribe to this family, share this video. Thank you so much for all your likes and comments. We the future, confidence in action. Thank you. Bye-bye.